Today, we are going to review the essential steps for the preparation and application of the dose rate calculator and dose error reduction system, or DERS, for the Meridium 3860 MRI IV infusion system. We will focus on dose, volume. Additionally, we will provide step-by-step instructions on how to set up an infusion using the dose error reduction system, or DERS, and dual infusion features. Prior to programming an IV infusion, ensure that all 3860 system components are sufficiently charged. All components are communicating on the same wireless channel. Be sure to use a new sealed IV set within its expiration date. Please review the initial setup and IV set selection videos if additional preparation information is required. For training purposes, this video series will use propofol in all demonstrations. Step 1. Infusing with the dose error reduction system, or DERS. IRadimed offers an optional feature for the 3860 pump called Dose Error Reduction System, or DERS. If your facility has purchased the DERS option, the pump will have an expanded drug library, complete with pre-programmed clinically defined infusion parameters, as well as hard and soft dosing safeguards. To access the DERS drug library, the user will press the soft key adjacent to New Patient Drug Library A on the pump's initial screen. Using the up and down arrow buttons, the user will search for the drug propofol and press Enter. The user will then press the soft key adjacent to Dose. Using the numeric keypad, the user will key in the dose and press Enter. Next, the user will press the soft key adjacent to Weight, key in the weight of the patient, and press Enter. Finally, the user will key in the volume to be infused and press the Enter button. Push Start A will appear on the pump screen in the bottom right corner. The user will press the Start Channel A button to begin the infusion. The status light will flash green, which indicates the pump is infusing. Step 2. Programming dual infusions. When the patient's care cycle calls for multiple medications, the Meridium can be programmed to complete 2 infusions per pump. Once the user has programmed Channel A using DERS or dose rate calculator, the user will program Channel B. To program Channel B using DERS or dose rate calculator, the user will first press the menu button. The user will then press the soft key adjacent to dose rate calculator B. Using the up and down arrows, the user will scroll to find the patient's prescribed medication. Once the appropriate medication has been found, the user will press the Enter button and then press the soft key adjacent to Dose on screen. Next, the user will key in the dose and press the Enter button. The concentration will already be pre-programmed. The user will then press the soft key adjacent to Volume to be infused and enter the volume to be infused using the numeric keypad and press the Enter button. Push Start B will appear on screen in the bottom right corner, and the user will start the infusion by pressing the B Start button. The status light will flash green, which indicates the pump is infusing. The dual infusion is now in progress. For more information, visit www.IRadimed.com. For technical support, please call 407-677-8022.